So he asked me to see about doing bypass surgery. Remember, there are two ways to fix blocked arteries. One of them is with bypass grafting, which is what I do. We steal an artery from your chest wall, steal some vein from your leg, and bypass the blockages. And then the other way to do that is with catheters and stents. And his sense was that would be very, very challenging in you because of the way the blockages go. And you're 60-something years old, correct?
Yeah, I'm 68.
68. And I know that, and then the other thing that we have that we didn't spend much time talking about with Dr. Miner is your aortic valve is abnormal. Is that news to you, or has someone told you you have a bad heart valve?
No, they told me anything.
Okay, it's kind of in the medium bad range, meaning if that's the only thing you had, we'd probably leave it alone. We wouldn't be talking about surgery for the valve itself. But since we're there with bypass surgery, sometimes we talk about swapping out the valve at the time of surgery. Sometimes we talk about just doing the bypass grafting and then doing a catheter valve down the road, where we just put a catheter in, put in a new valve, and then you go home the next day.
Wow.
But I just texted Dr. Miner to see if he feels strongly either way about what to do with that aortic valve. So I'll wait to hear back from him. So it leaks and it's narrowed. Those are the two things that can happen to valves, is they can get narrowed, making it harder for your heart to pump blood through a narrow valve, or it can get leaky, and you've got both. So my preference would be, at the same time, might as well just get rid of all the bad stuff and get it all cleaned out. But he's asked me to see you, so I'll talk to him.
You cut me open.
Say again?
You cut me open.
Yeah, either way, we go through the incision through the front, and then put a retractor to move the breastbone out of the way, and then we can work on the heart for both the bypass graft and or the aortic valve.
So if I don't do any of that, then I just stay like how this is?
Yeah. If
How
you,
I walk it?
yes, and the big concern is the most important artery in your heart is called the left main coronary artery, and for you it does all the work. All the left-sided arteries come through that they branch off of that artery. The one on your right side is completely plugged up and it's siphoning a little blood from the left side. So if that's 75% blocked up, if that were to go down, that would end your life.
Wow, 75%.
Mm-hmm. And we care about it after 50%. Anything above 50, we care about, and hers is 75%.
Wow.
So I think the answer to your question is yes, you would feel unchanged, but you'd have the risk of having a massive heart attack. That if you have several different blood vessels, you're okay, but all of your blood vessels are coming off of one common trunk. So I think that would likely be a life-altering or life-ending heart attack for you, unfortunately. Unfortunately.
And so if I get this done, what then?
Then your breathing symptoms should be better. The risk of having a heart attack go way down, and the likelihood of living to whatever you were going to live to are a lot more likely. I know the kidneys aren't good, I know you've got your fistula, you've got a lot going on, but this would likely extend your life if we did the surgery.
You're looking at about how long?
I don't know, because we don't know a lot about 68-year-olds who have dialysis and also have coronary and valve disease. We don't know much about that.
And lower back bone neuropathy.
Yeah. So I don't think it's and I think you're very smart to ask the questions. What do I do if I don't? Is there anything we can do instead of that? As if you said, surgery makes zero sense to me. I have no interest in the week in the hospital and the 5 weeks recuperating at home, which is fine. You're up moving around. You're just sore here, and we don't ask you to use your arms much. Then I could always go back to Dr. Miner and say, she refused surgery. She doesn't want to go down that pathway. Is there anything he can do? And he can usually say something to the effect of, yes, I could probably help, but I don't think I could get all the blockages. That's usually the answer when they refer to surgery, which might be good enough from your perspective, and that's fine. No one's going to judge you on the decisions you make, but our job's to help kind of show you the issues at play and help you make a good decision for you.
Yeah, I'm old.
Well, let me tell you a little about the risks, and then that'll help you make a decision. Does that sound good? So the conversation I'll have will probably be about the bypasses and the aortic valve. So I think the risk to your life is probably about 4, maybe 5%. The risk of dying through the whole thing is 4 or 5%. Other things can happen: heart attacks, strokes, kidneys, liver, lungs can get sick.
Even after I get this.
This is the month, from the time of surgery for the few weeks after surgery. That's the highest risk. We'll talk about your kidneys special in a minute, but the heart attack, strokes, kidney, liver, lungs getting sick, I'd add those up to be about 6 or 7%. So if you add those two together, you're probably about 87 to 88%, or 88 out of 100, you're gonna come through this just fine. So good numbers. If you didn't have any medical problems, et cetera, the risk would probably be about 3%. So maybe 2 to 3%. The operation would take the better part of a work day. So in the operating room at 7:30, out by mid-afternoon, go to the ICU. Breathing tube usually comes out by supper time, maybe early evening. And I think you'd end up staying 1 or 2 nights with us in the ICU because we'd need to do dialysis. We can't ask your kidneys to get all the fluid off of, so we'll have to do it with a dialysis machine. Sometimes it's 3 nights in the ICU, but that's okay. That's normal for the patients we operate on who have dialysis. My guess is you'd stay about 7 to 10 days total in the hospital, just depending on how long you would be in the ICU, how long it takes to get your volume right with dialysis. It's just slower with dialysis. By the time you left the hospital, remind me, you walk with a walker at home, is that correct?
I used to walk here, but today I just couldn't.
It was just today, okay. So I think that you'd be walking with our therapist, you'd be walking and using the toilet and brushing your teeth all by yourself by the time you left the hospital. If you felt strong enough, you'd go straight home. Some older patients who don't feel super strong before surgery need to go to a rehab place for a week or so before they head back home. But for you, I'd say it's probably 30-40% of not being able to just go straight home after the hospitalization. The main limitation is a broken bone that we have to divide to get to your heart, and that needs 6 weeks to heal up. So we just ask you not to use your arms for lifting anything heavy or pulling yourself up for about 6 weeks till that bone can heal. So that's what surgery would look like. Again, you look quite skeptical about, feeling like you're up to something that I'm talking about. So if it helps, I'm happy to talk to Dr. Miner and say, she's very reluctant to proceed with surgery. Can you look at her films again and call her and see what you might be able to do with a catheter, which would be easier on you, but not as durable or complete. So those are the trade-offs. So big surgery's more durable, it's more complete. On the other hand, the catheter therapies is less durable, less complete. But for a lot of people, that might make sense if we don't think they're strong enough or healthy enough to get through a big operation. What questions can I answer for you? And again, you don't have to make a decision today. The goal here is to talk to you and educate you and see what makes sense for you, help you make a decision. And you don't need to decide today. You can go home and talk about it with your family, and I'm just here to answer whatever questions I can answer.
Yeah, I'm gonna have to go home.
Okay, all right. And I'll also talk to Dr. Miner and say she's very reluctant, and he might give you a call and chat with you again, okay? Because I'll probably be, in my note, to say reluctant, probably not wanting to proceed with surgery from the looks you're giving me.
I gotta figure it out in my mind.
Sounds good. Can I take a listen to your heart and lungs? I don't think I got a great listen when we were in the hospital the other day, because I didn't have my ears on me. Can you lean forward just a little bit, please?
Mm-hmm.
All right, regular rhythm. Probably a 2 out of 6 systolic. Nothing, sorry, didn't mean to bumper car you there. Any swelling in your ankles or your feet? And your dialysis catheter is just down here where it usually is.
Yeah, No swelling.
But that's just where your catheter is? Okay.
Yeah, that's when I can.
After surgery, you said you make a little urine when we chatted the other day, but not much.
Not that much at all.
It will likely go to 0 or almost 0 after surgery. So heart surgery is pretty tough on kidneys. So whatever kidney function you have right now might get worse. And that sometimes means people can't do peritoneal dialysis anymore. Sometimes it always has to be hemodialysis after heart surgery. Maybe a 50-50 chance of being able to stay on the dialysis, the peritoneal dialysis. So keep that in mind as you talk to your family, as it might be very hard. The catheterizations that Dr. Miner does, they can also hurt the kidneys. So either way, there's a risk to the kidneys. Probably a little less with Dr. Miner's, but probably pretty much the same risk. Because that would change your life a lot, not being able to do dialysis at home. You'd have to do it at a dialysis center. So keep that in mind as you make your decision.
No, I didn't know that part too, so thank you.
Yeah, it's important. I always have to have that conversation with peritoneal dialysis patients. No, you're fine. Other questions Lori and I can answer to give you info to chat with your family and make a good
If she
decision?
does decide to proceed with
Yeah.
the surgery, how soon would the?
I think we can do it the next couple of weeks. Maybe early April is kind of when I'm probably have availability. So, should I have my office team call you at home in a couple of days and see
Yeah.
what you're thinking?
That was
Okay.
good.
Lori, anything else you'd like to
No,
add?
I think we're fine.
Okay. All right.
Oh,
Nice.
you're allergic to something, is that right? Are you allergic to anything?
Nothing right now.
Nothing, okay.
Okay.
Someone else says, okay.
Well, why don't you follow me up to the front desk and we'll talk to Mikkel about giving you a phone call in a couple of days, okay?
Okay.
That sound good? Don't forget your drink.
Yeah.